Hello everyone. I'm here welcoming you from ICS Life Lounge. I am Yasser Farahat. I am the chairman of Scientific Office of Emirates Urological Society, and it's a great honor to be here today with two eminent colleagues from Emirates Urological Society. I have Professor Mohsen Elmekresh. He is a consultant, senior consultant of endourology and uro-oncology and working at Mediclinic Abu Dhabi. Welcome, Dr. Mohsen.
Thank you, Dr. Yassir.
And also, it's our pleasure to have Professor Yassir Saeedi. He is the president of Emirates Urological Society and senior consultant and head of department at Dubai Hospital. And he's one of the eminent robotic surgeons here in United Arab Emirates. Welcome, Yassir.
Welcome. Thank you very much.
So it's really, I'd like to take the chance to discuss with you about the program of this year conference, of EUS conference. And I think it's a new opportunity that we have the EUS joined or hosting the ICS annual conference to be the first time here in the Middle East of Abu Dhabi. Dr. Mohsen, what's your impression about joining these two conferences together?
I think this year was special because we are hosting an internationally recognized conference like the ICS, and by this way converting this one into an international meeting in the city of Abu Dhabi makes us meet a huge gathering of local, regional and international experts discussing together and sharing expertise in different areas of urology, including and not limited to incontinence, of course, and stone surgery and allied technologies, oncology, dealing with tumors of different types, together with workshops for the young urologists. And of course, we are not forgetting the high-notch technology in terms of the AI, virtual reality introduction into the field of urology.
Yeah. Dr. Yassir, what's your impression about the attendees, the participation, how they are engaged in the two different specialty? ICS is covering a certain area of urology and EUS covering other topics in urology. How do you see this joining different perspectives?
Actually, the integration of EUS and ICS in one place gives the chance for the local attendees and the international attendees to connect with each other. It opens opportunities of research, collaboration, exchange of ideas, and help our local and regional professionals to have a better view of a topic which was in general under the umbrella of urology, now being discussed in this conference in more detail. Incontinence, not only urinary incontinence, but even fecal incontinence, and topics that are related to gynecologists in particular, prolapses, female issues, which were a bit under-focused when you come to a conference where you have discussions about all subspecialties in urology. Now we are focusing this year on a certain subspecialty which will give more information and more depth to our discussion.
Yeah, actually this will take me to an important part that during planning for the scientific program, we tried to avoid the overlaps between what EUS will cover and the ICS regular topics they cover. So, for example, Dr. Mohsen, we have an interesting interactive session about stone disease or urolithiasis to cover all aspects of urolithiasis. Let me to ask, why this topic important in our region from your point of view to be highly discussed in depth in such conference?
Thank you for raising this topic up because we in this area have a hot weather across the year, so the prevalence of stone formation is very high. So stone surgery and stone management is bread and butter for every urologist right here. And now the business of stone surgery is driven by personalized demand from the patient side and from the healthcare industry as well. From the healthcare industry, they are concentrating on the cost, early discharge from the hospital, and normal or back to normal activity as short as possible. From the patient side, he is looking for minimally invasive procedure, no pain, preferable without anesthesia, using the high technology, and attaining the ultimate goal of a stone-free rate and patient discharge. We are tackling this one in different sessions, and we have workshops. And if you look into what is introduced in the conference and the presentation workshops, 3 areas were tackled. Number 1, the key technologies, emerging technologies in terms of new lasers like thulium laser, which enable us to make dusting of the stone like sand, flexible or single-use scoops whereby you just use it for once, reducing the cross-infection, etc., etc. The maneuverability and the comfort we are facing right now is better than before compared to the early instruments we have. Introduction of robotics in ureteroscopy, percutaneous stone removal, etc., is another added value. Suction or access sheets to drain what we disintegrating into sand will help us for better visualization, keeping the pelvis, the pressure inside the pelvis of the kidney as low as possible, monitored all through. And using the AI, deep machine learning, etc., will enable us for correct puncture of the kidney if we use minimally invasive keyhole to remove the stones. And there is some softwares now who can predict the metabolic component of the stone and preventing recurrence in the near future.
Yeah. Dr. Yassir, Dr. Mohsen highlighted an important point why the stone disease is an important problem in our region. From your experience, do you think the weather is the only factor for having high incidence of stone diseases, or maybe other factors like dietary or something else?
Actually, in the last 5 years, I've been seeing increase in stones even in the pediatric age group. Genetic factor is one of the important factors that is a main reason for stone development. Families having hereditary traits for cystine stones, young children at early age. The youngest I've seen was 13 months with a 1 centimeter stone stuck in the upper ureter. We have seen complete staghorn stones in a 4 years old girl recently, which is again a cystine stone and related to the familial genetic issue.
So rather than the genetic factor, do you feel that in our community the dietary habits plays a role in that?
Sure, because of the warm weather,
and
dehydration is one factor. People are having more sedentary lifestyle, rich fatty, high sugar intake is very important in the development of stones. And all these factors combined are really controlled by the weather. Because of the hot weather, people tend to stay indoors. Staying indoor with the modern lifestyle, either in front of their digital tools or a TV, they tend to forget about exercise, they tend to forget about hydration, And these are all factors causing recurrence of renal stone and development of stones.
I have to add to this one, excuse me. We are lucky in this area of the world that everyone is insured and we have easy access to the healthcare system. This enables us as urologists to pick up the stones as early as we can, even asymptomatic stones, and together with the advanced technology and imaging techniques, enable us also. So the easy access to the healthcare plus the imaging techniques enable us to discover more and more of stone disease.
So this will take me to the point, the privilege of opportunity of those population living in such country. There is a good infrastructure in healthcare system. So are we updated with the international level of new technology in both diagnostic and therapeutic in stone disease?
100%.
Yeah.
We are to the edge of the knowledge and cut edge of the knowledge, if you agree.
Yes.
We have the robotic ureteroscopes. We apply the 3D imaging right now in all aspects, including CT. We're having some nomograms using the nephrograms to decide the size of the stone. Chemical analysis for all the stone removed to make preventive protocols to avoid recurrence of the stone. And we do some mapping for genetic, and the EUS genomes, I think, will serve in this direction.
Okay. Yes. So, Dr. Yassir, the technology is there, the highest level of new or modern modalities for treatment of the stone, but we should focus about the manpower who is utilizing this new technology. And I'd like to understand from you what are the plans for training and education of young doctors to be professional and utilizing this new technology in the right way.
Sure, now being in a teaching environment as a program director of urology residency program in Dubai, we have dedicated simulation setups for training of our residents. Once we reach to a level where we feel that our trainees are safe and confident in doing these procedures, they tend to do these procedures under supervision, and by the end of their residency program they are well established and capable of managing most of stone diseases with different approaches, with different technologies that are available. The boot camps and the workshops that are in the conference are some of these tools. Adding to that, internally we are providing these courses on smaller groups of candidates so that they would have more chance as hands-on. Having a high rate of stone disease makes the number of patients that are seeking medical help to treat this disease coming to our centers are the majority. We are talking about more than 60% of our daily activities are stone disease currently. Gives them more exposure to this specific problem, and they know the ins and outs of all steps in the patient management, from diagnosis, treatment, to follow-up, to prevention, to screening later on. So everything is available, and the trainees are really active in this.
It's great to hear that we have in this area of the world updated recent technology in different modalities, and we have programs for training and building capacity of talented surgeons that can utilize this technology for the best of the patient. The third arm of the disease, which is the patient himself, how the awareness of the patient about some disease, especially a common disease like stone disease, what is the role of the society to help in public awareness about prevention and the early detection and treatment of stones.
I think we are lucky again, added to the previous point, that we have the Arabic School of Urology, which is the teaching body of the Arab Association of Urology, which is helping teaching the young generation. And it came up, the idea from Dr. Yassir last year, having established the concept of stone care clinic, whereby everyone interested in this subject will be like multidisciplinary team, not only treating the stone, but avoiding and preventing recurrence of the stone. So we have urologists, we have nephrologists, we have dietitians, and we have everyone around the table to discuss and manage this stone in the future. And we have another opportunity, meeting the first contact of the healthcare sector with our patient, which is the GPs and the family doctors. Every year we are holding the interdisciplinary urology care consortium, whereby we meet our colleagues from our subspecialties to highlight this issue and to educate them to treat the patient and to be a good referring physician for the specialist.
Okay. Before closing this interesting discussion, I'd like to have a single statement from each of you about what's the most important in this conference about stone disease. What had been done and you like it?
Personally, the workshop, the hands-on, it's a great opportunity to show the most recent cutting-edge technologies and the treatment to all our colleagues and to our younger generation urologists.
Good. Dr. Mohsen, what?
Having a good simulators for the new technology and giving the chance for the new doctors to try it.
That's wonderful. I'd like to personally add that this year it's a great opportunity that having some sort of exchange of experience between the local, regional, and the international speakers under one roof, discussing same topic, like different opinions, different kind of practice, to reach to a consensus about the best clinical practice to our patient. At the end, I'd like to thank Professor Mohsen, Dr. Yassir, to being here in the ICS Life Lounge, and it was wonderful gathering, and I wish to have this conference more and more in our region. Thank you.